GRNorth would like to thank Angie Briggs-Johnson for her participation in this project.
In looking at the definition or principles of art therapy, we can go back to the American Art Therapy Association itself. They speak of art therapy as a therapeutic use of art within a professional relationship by people who experience illness, trauma, or challenges in living, and by people who seek personal development. They believe that through creating art and reflecting on the art products and processes, that people can increase awareness of self and others. They can cope with symptoms, stress, and traumatic experiences, and enhance cognitive abilities, all while enjoying the life-affirming pleasures of making art. We look back in time and we see that art was originally there since the beginning. It was used as communication. Think of the paintings on the walls of the cave. Only in the 1940s was art first used for therapy in America and Europe. It was actually began by a patient himself, Adrian Hill. He used art as therapy. He was an artist, and he suggested to the other patients in the sanatorium where he was due to tuberculosis that they should try art, and noted how it helped him. Soon, art therapy began to spread. The first American pioneers of art therapy were Margaret Nomberg and Edith Kramer, and that was in the mid-1940s. They began teaching others how to become art therapists. Today, most art programs are used as a method or a mode to understanding the needs of the patient. There's multiple settings that it's used today: psychiatric hospitals, outpatient treatment centers, schools, shelters, missions, nursing homes, residential treatment facilities, and in private practice. There is an Art Therapy Credentials Board, and they are associated, and individuals must be certified within them. They must have a master's level, hold a degree in art therapy or related field, and their educational requirements do include theories of art and counseling, psychotherapy, ethics, standards, assessment, evaluation, and they serve individual, group, and families. Human and creative development is studied, as well as multicultural issues. Art therapists are skilled in the application of a variety of art modalities.
Art therapy has been around for centuries. Over the last few years, art therapy has become a more popular approach because it's multimodal, and it has been demonstrated to be effective with all ages, populations, and therapeutic issues. The studies that we found as a group were groups such as at-risk youth with trauma, women with substance abuse issues, Native American cancer survivors, caregivers of cancer patients, elderly, and families. What art therapy does, though, is it really provides a metaphor and narrative to explain the issues the client has going on. It provides the therapist a way to do a non-judgmental assessment, and it allows people to verbalize forbidden information. Take, for example, a child who has experienced sexual abuse and has been forbidden to talk about it. It reduces the number of unproductive conversations because the therapist can really hone in on the piece of art and specifically ask questions based on what was created. And it also provides a concrete reminder of those conversations. For example, if a family does a painting or a sculpture, maybe it's their family manifesto and their goals of what they're going to do to love, share, laugh, and do those sort of things. So it reminds them of the conversations and what they're working on in therapy. It raises self-esteem because it gives a sense of completeness and something that you've created and you've followed through on. And it allows for creative expression to share things that seem too personal to talk about. And it breaks down the barriers and it can be used in so many different ways with so many different people. It can be used with groups and families and individuals, as I touched on earlier. It can be used in schools for social, emotional, and even physical things like hand-eye coordination. And I said earlier too, it's so versatile because it can be done with so many different modalities. Some examples could be like pastels or markers, beads, clay, pencils, or even sand trays, paints, all kinds of different things. And it really gives the client a sense of freedom to be able to choose however they want to express themselves.
Art therapy is often used with children, but it is also an essential tool in adult therapy as well. There are several issues in which art therapy can be used with adults, such as the following: trauma and abuse, addictions, dementia, eating disorders, learning difficulties, offenders, palliative care, depression, personality disorders, and psychotic disorders. Neurologic disorders, including dementia. Art programs for individuals with a neurologic concern are generally set up in a nursing home environment. Under the premise of a stroke, an individual may start using parts of their brain to compensate, which often opens the door to creativity that they have not accessed previously. Also, for stroke victims, there is a physical component that is helpful, as when patients hold art tools such as a paintbrush, there is a therapeutic process in the development of their small motor skills. With dementia patients, when their processing skills have become more limited, it results in a less calculated response. People who were hesitant to participate in art at an earlier time find their inhibitions are lost. The thought that their art is not good enough or that they will be embarrassed is no longer present, and the art flows. There are 3 goals within the neurologic disorders portion. Number 1, to work with the person's immediate problem, whether this be physical or emotional or cognitive. Number 2, to deal with the issues pertinent to old age. Changes in behavior or cognitive functioning can all flow into this piece. Number 3, to help provide the client with a sense of dignity. The last piece is art therapy programs are at times difficult to develop. There are questions that surround this. The first one being, what is age appropriate? This is asked in order to promote dignity and self-worth in the individual. Activities must fit the level that the person is at, cognitively speaking, without adding insult. The next question is, what is physically appropriate? Is the patient going to be able to participate in the art therapy activity with little physical difficulty? Each of these questions are essential when deciding what kind of activities will be included in the development of the program. Finally, we will focus on palliative cancer care and the dying. There are 2 sections to this piece, the physical components and the emotional ones. We will start with the physical piece. There are a number of components that individuals have deemed as unsatisfactory responses to the disease process. They include pain, tiredness, depression, anxiety, drowsiness, a lowered sense of well-being, breathlessness, decrease in appetite, and nausea. Within the study, it was concluded that art therapy as an intervention, all of these symptoms were reduced with the exception of nausea. Patients felt an overwhelming positive reaction to art therapy. In the emotional components, emotionally speaking, there was a positive increase in feelings of calmness, security, ease, restfulness, comfort, self-consciousness, relaxed behavior, contentment, joyfulness, and pleasant behavior. These are all positive indications that art therapy works with individuals within their dying process.
The first slide here are just some quotes from a few of the authors of the studies that seemed really relevant to looking at art therapy as kind of a multicultural intervention. The first one there from Sasson, Spencer, and Curtin. They did a study with urban middle school girls, a really varied group of ethnicities and abilities, and found that art therapy moved along the adolescents' ability to develop relationships with each other. Stock, Mears, and Robinson did a family intervention with parents and children in Australia who were Aboriginal. And they looked at how art therapy allowed them to externalize their stories. Finally, that last quote there, art reaches across cultures, creating an alternate language. Art is common to all peoples throughout history, and so you can tailor projects that you do in art therapy to the client. For the second one, art is interactive and active, opening creative expression when language may be a barrier. That's when language literally is a barrier, like when English is the second language or when the therapist and client don't speak the same language. Finally, art honors and makes real the client experience. So it can be a tool to help people tell their story. There was an article I read about Bosnian war refugees, and a group of women made a quilt where the quilt squares told the stories of the individual women's experiences in the war.
We are going to take a look at the critical review of this model. We'll start off by looking at the strengths. As noted by Riley in 2001, teenagers are sensitive about their images and put themselves at emotional risk rather than confessing that they need help. This has been further emphasized by the media portrayal of talking therapy being for severe mental cases. In contrast, youth come to art therapy without these preconceived ideas. It taps into a person's creativity and earliest ways of knowing and reacting to their own worlds. It offers a form of communication that is non-threatening. It is known as symbolic or visual speech, but can facilitate the development of verbal speech. Individuals feel as though they have control over this casual approach. It provides a pleasure factor and stimulates a desire to be expressive. It gives the therapist an insight to concerns and life circumstances, ones which may be too sensitive or embarrassing to verbally disclose, and it also promotes self-expression with the individual. Now we're going to look at some of the limitations and complications. As noted by Fulcrott and Davenport in 2010, environmental modeling, temperament, and biological neurological factors are important elements to treatment. In art therapy, economic, content, and environmental modeling is viewed to be sometimes ignored or less emphasized during play therapy, as based on some previous studies. There is not a lot of empirical evidence to support how this intervention facilitates changes in behavior. The therapeutic relationship is not always as strong. For some, it can be viewed as intrusive or childish, and individuals may be hesitant to take the lead, especially if they feel creativity does not come naturally. Additional materials are needed, such as paint, paper, figurines, etc. Many agencies and schools lack professionals with adequate training, since you must be fully qualified to perform this intervention. Is the intervention model more or less applicable? The intervention is more applicable among individuals who may be looking for an alternative to talk therapy. It is beneficial to those who have suffered from trauma, illness, or other life challenges, as it allows them to create coping skills. It can be used with all populations among various settings. It can be viewed as less applicable for persons with severe cognitive impairments or psychosis, as they might not respond as well or might not be in the right mindset for this type of intervention. Also, extreme behavioral cases may not be as applicable due to their need for modeling. Therapists show flexibility and willingness to alter treatment based on the interaction during this process. The primary goal is to help those in need, otherwise known as commitment to clients. The therapist follows the individual's lead, promoting self-determination. As noted by the National Association of Social Workers, this is done by showing respect and promoting their rights in order for them to identify goals. Cultural sensitivity and respect is fully present. The therapist must show competency by receiving appropriate training and education before administering this type of intervention.